The company has stated in some SEC filings that the Affordable Care Act could increase its costs. How so, and how is that actually playing out?
Well, Starbucks has long been committed to healthcare. In fact, way back in the late 1980s, when we were a privately held company, not making money yet, it was a company committed to comprehensive healthcare for part-time employees. People working 20 hours or more in our stores, in our roasting plants, anywhere in the company, had access to comprehensive, affordable healthcare more than 20 years ago. It's been a pillar of our company throughout that entire period of time, and I think has significantly defined who we are to our partners, which is what we call our employees, all through that span of time. Affordable Care Act is actually less generous than what the Starbucks healthcare plan is. There's likely not to be any incremental spend. There is a little bit of administrative work for us to do to adopt to the new legislation. But what we've committed to do most importantly is, because our healthcare is actually more generous, it kicks in for partners and families at just 20 hours a week, more than what has been legislated. We've committed to our partners that we're going to stick with that. We're not changing our plan.
You must have some research, or at least some feeling on how important that is for you in attracting and keeping the people you want to attract and keep.
There's no question that things like our healthcare program for a long-standing period of time, Beanstalk, which is our broad-based equity plan, also since we were a privately held company 20 years ago, that offers stock options and restricted stock to people working 20 hours or more. Right. All of those things are a clear measure to our partners that we value them, right. And it's clear recognition that it's the partners who take care of those fantastic customer experiences in our stores. Right. We know when we do that right, that leads to success. And I think the history of Starbucks, the results we've been able to deliver quarter in and quarter out, are clear demonstration that if you do the right thing for your people, the business takes care of itself.
You do have the big employer perspective on this.
Yes.
How do you expect the Affordable Care Act to influence large employees when it comes to how many hours people work, whether it's more or fewer than 30 hours a week, and such things?
We are concerned about some of the unintended consequences of the Affordable Care Act and some of the challenges around implementation. Clearly, having wide access to health care is critical to our country and to our people in this nation. We are highly supportive of it, obviously evidenced by the fact that we've had it for a long, long time. But we're concerned about what is happening as we watch other companies. I'm not sure I can predict what happens to employment, but it is something we're watching closely, and would encourage all companies to ensure they're doing the right thing for people and taking care of health care in the way it's intended to do.